Welcome to Staying Connected, a podcast where I talk to people about their stories with VEDS, Marfan, Loeys-Dietz, and related vascular and aortic connective tissue conditions. This is your host, Katie, and before we get into the show, I want to remind you that the views, information, and opinions in this podcast are those of the individuals involved, and the information presented does not constitute medical or other professional advice or services. Any opinions that I express in this podcast are my own and not of my employer. Welcome back. In this episode, we're going to talk to Dr. David Murdock, a clinical geneticist at the University of Texas Health Science Center, who is doing research in connective tissue conditions, including VEDS, Marfan, and Loeys-Dietz. Before we jump into the interview, if you like this podcast and want to support our community in our efforts to raise awareness through this show, you can buy merch in my Printify pop-up store, make a one-time donation, or support the show by joining my Patreon. This show wouldn't be possible without the continued support of my Patreon subscribers and donors. So if you've already been supporting the show, thank you. Check out the episode show notes for links to ways to support. Let's get into the interview with David. Hey, David, thank you so much for coming on the podcast to share your involvement in research in the VEDS, Marfan, and I think Loeys-Dietz community too, and just thank you for coming on to the podcast. Do you want to introduce yourself to everybody that doesn't know you?
Sure. Thank you so much, Katie. I'm David Murdock. I'm a clinical geneticist in Houston at the University of Texas Health Science Center, Houston, or UT Health Houston. And I study conditions that affect the cardiovascular system, as you mentioned, Marfan syndrome, Loeys-Dietz syndrome, vascular EDS, and others that lead to so-called connective tissue disorders. So,
how did you get into that field? Like, how did you get interested in, I guess, both genetics and connective tissue disorders specifically?
Yeah, so that's I could talk several hours about how that happened, but I think it was kind of an incremental thing. It kind of starts with my upbringing. I grew up in Houston, Texas, which is well known for being a center for cardiovascular care. My father was a heart surgeon, and so I kind of just grew up always hearing about the heart, the aorta, the blood vessels, and so that's just kind of the environment that I grew up in, hearing about all the incredible surgeons that had really developed a lot of the skills that are used commonly now, people like Michael DeBakey, Denton Cooley, Stanley Crawford, et cetera. So that kind of, got me interested in the cardiovascular system in general. In terms of kind of genetics, jump forward many years when I was in medical school, and I did my med school at Baylor College of Medicine in Houston, which is really an incredible institution for genetics in general, clinical genetics. And I remember having lectures from these incredible geneticists and just being so fascinated by that field. It was kind of like this code that if you could somehow understand it, you could really improve the lives of patients with various genetic conditions. And so I leapt at the opportunity to do clinical rotations in genetics and just really fell in love with it and was mentored by some incredible people and just developed a real affinity for genetics. I went on to do internal medicine and then followed by a clinical genetics training program where I was exposed to cardiovascular genetics at Johns Hopkins, and worked in a connective tissue clinic there with Hal Dietz, with Gretchen McCarrick, and others, and just really, really loved those patients that have Marfan, Loeys-Dietz, VEDS, et cetera. So that's kind of, a big part of it. The other side of it, which you and I have talked about, is that my wife also has Marfan syndrome. And so that was kind of confirmed when after we were married. And so I always, she had kind of suspected that she might have it, but it wasn't confirmed until we were married. And so we've had to deal with a lot of the issues that come along with that diagnosis. And so, I feel that my background and going into genetics and then my experience with her has really focused my interests in this particular field. So yeah, that's kind of the short story.
Yeah. And I just want to say, for people listening, I guess want to say thank you to your wife for like being comfortable with you coming on and sharing this information. Like, I know that she wasn't available for the podcast today, but she's, said that she was totally okay with it, which I so appreciate. So I've known you for the last few years working, like I know that you work at UT Houston with Diana Milowitz.
Exactly.
And you're doing some pretty exciting research. Do you want to talk about some of those research projects that are going on?
Yeah, absolutely. Yes, I mean, I've been at UT Houston now for exactly 3 years and working with Diana Milowitz, who's just an incredible kind of expert in the field and really has done incredible work kind of defining these conditions and developing a lot of the guidelines for how we manage them. So I came to work with her largely because I really wanted to focus on all my efforts on better understanding these conditions and what we can do to improve the lives of affected individuals. So I would say kind of I do a lot of things at UT, but kind of the main two things that I do are, number one, trying to find new genes when we test the known genes for Marfan, Loeys-Dietz, VEDS, et cetera. But testing comes back negative, but there's a very strong suspicion that it's genetic or inherited, but we haven't been able to find anything. I've been doing a lot of analyzing large, what are called biobank data sets to try to identify new causative genes, and it's actually working quite well. And hopefully in the next year or two, we'll have some new genes that can be added to the panels and kind of just add to the what we know about these conditions in general and what kind of potential therapies can be made for them.
So on that topic, that's pretty exciting stuff, because I know that there are people in the community, in the broader community of connective tissue disorders that like have a history, like whether it's like aortic dissection or multiple aneurysms or, and they really feel like they might have VEDS or they fit the criteria for like Loeys-Dietz or Marfan syndrome, but they don't have a genetic answer. Are these, so is your research into that, is that something that individuals can get involved in, or is that more like how if someone's very interested in that, how would they learn more about that?
Yeah, so I mean, we have so Diana Milowitz has an established research program where we enroll people into our study. It's free of cost, and we'll kind of communicate with that person and then kind of determine whether they're a good fit for the research program. And then, if they are, then it really doesn't matter where they are in the world. We can send out a sample kit or something and get them as part of the program remotely. But yes, maybe afterwards I can give you the contact information for that. If you would like to share that, you could even just Google it, UT Houston, Diana Milowitz research program. It'll come up. But that's a big problem because, right now, a lot of people, even when it's clearly, we take the family history and everything and you see it's very clearly running in the family, something we call like autosomal dominant type inheritance. And we test them with the latest gene panels and nothing turns out positive. It could either be, number one, that perhaps when we're testing, we're not looking in the right parts of the known genes, which is an issue and we're also working on. But it's also likely that there are additional genes that have yet to be discovered. And so that's what I'm kind of focused on more recently. And it's especially true for what we call non-syndromic conditions where there's a genetic risk, but it's really related to the aorta or to the arteries. And rather than having kind of external syndromic features that you might see with like Marfan syndrome or something. So yeah, it's really exciting work. And I think it's coming along, and hopefully, like I said, in a year or two, we'll be able to add these genes to panels and hopefully better diagnose people and better manage them for improved outcomes.
Yeah, that's amazing. Is that like the non-syndromic that you're talking about? Is that kind of like the ACTA? Is it ACTA2 or MYH11? I've just heard other genes like, and And I know some of
Yeah.
those people affected by that might be listening.
Yeah, you're exactly right. So ACTA2, which is Diana Milowitz, she discovered that, and along with many of these other genes. But yeah, ACTA2 is the most common cause of non-syndromic thoracic aortic disease. It's a really interesting gene because it can also cause another condition called SMDS, but that's maybe for another interview. But yeah, you're right. MYH11, MYLK, PRKG1, these are so-called non-syndromic genes. But yeah, so we're finding new genes, and in reality, the kind of distinction between syndromic and non-syndromic is not quite so clear cut. There are some people that have Loeys-Dietz syndrome, for example, that have very mild external features, but when we test them, it turns out that they have Loeys-Dietz. So, but we just kind of use that syndromic and non-syndromic just to kind of make it easier to talk about.
I guess I'm getting into the weeds here, but I'm just so interested, and I don't know if other people might be interested as well. Like, when you look at that data, like, what does it take to classify? Like, you're looking for a gene, and let's say like you have a list of suspect genes that might be. Like, how do you then take that from, okay, I suspect this gene might be, I guess, how do you even suspect a gene might be involved in this? And then how do you take that from maybe to definitely to like classifying it? I guess in layman's terms, how does that process happen?
Yeah, no, that's a great question. And it's something I deal with all the time. So there are different approaches to trying to find these genes in the first place. The kind of traditional approach is where you identify affected families, where unsolved affected families, and you do something like exome or genome sequencing, where you're sequencing essentially every gene in all of those people, and then kind of seeing which genetic variants they share in common, which ones they don't, and kind of by a process of just trying to narrow down the list of potential genes that gene variants that it might be. So that works really well, but it can take a long time because you're kind of going family by family by family. And for some of these conditions that are super rare, you may not encounter another family that has a genetic variant in that same gene. And so you'll never know that could potentially be a new disease gene or a new gene. So that's one approach, and that works great. Kind of the approach that we're taking now is leveraging these huge like biobank data sets that have whole genome sequencing from hundreds of thousands of individuals, and just kind of looking across the whole genomes and looking for which genes tend to pop up more often than others in people who, let's say, have an aortic dissection and those who don't. And by doing it that way, you can, because you're looking at such huge data sets, you have a better chance of picking up something novel. And that's kind of the approach that I've been taking, where we've found a few of these genes that look pretty real. So, but once you find those genes, then you have to prove that they actually cause something. And so that's where things like animal models or cell models, different kind of cellular experiments you can do to really decipher what is this gene doing when it's not working properly. What pathways is it involved in? If you develop an animal model that has a variant in this gene, what is the phenotype of the animal? What are the manifestations in that animal? Does it look like a human with that? Do the animals have vascular issues like humans do? So that's kind of the hard part. That takes a long time. That's not so much what I do, but a lot of the people that I work with in Diana Milowitz's lab, they kind of take that and then kind of prove that these genes are in fact causative. But I'm more kind of the computational kind of bioinformatics side, where I try to use all these different tools to find the genes, find the needle in the haystack, and then my colleagues can take those findings and then kind of really prove that these genes actually do what we think they do. But so that's kind of overall. in terms of just, as you can probably imagine, when you're looking at these huge data sets, you're dealing with enormous number of genetic variants, and how do you narrow down what is just noise and what isn't? And that comes down to, you can look at things like how often is this genetic change or variant seen in the general population? What kind of change is it? Is it something called a missense variant or something called a loss of function variant? How well is that particular change conserved across different species? Like if humans or if this person has a change, but we see that in other animals, that change is seen very commonly, then that probably means it probably doesn't do anything. It's just kind of part of evolution or something. So yeah, I mean, there are all these kind of additional bits of information that we use to really help narrow down what are the important variants to look at. And that takes a long time, and it's not always very straightforward, but it's fun. I mean, that's why I do what I do.
Yeah, it's great. It's great, important work to be doing and to help find answers for people who don't have them. Like, it's just really important work.
Yeah.
You're doing some other research too. Mm-hmm. Do you want to talk about some of your other studies?
Yeah, absolutely. So the other side of what I do kind of falls more under the umbrella of kind of artificial intelligence, although my other work, does involve some degree of that as well. But this is some kind of very different but very exciting work where we're trying to develop a screening tool to look at the images of people's faces to determine whether or not they might have one of these genetic conditions. And kind of what I talked about earlier, some of these syndromes like Marfan, Loeys-Dietz, VEDS, they have characteristic facial features that we learn to recognize them. When I did my genetics training, we had a principle, something called dysmorphology, that we were really trained to distinguish some of the characteristic features of various conditions. And so this is kind of going to the next step, where rather than just kind of relying on our own eyes, we're developing an AI-based tool that can do that much better than we can. And it's not a new idea necessarily, but it's never really been used for these particular types of conditions. And so our goal is to develop like an app for a phone that a medical provider, a pediatrician, an ER physician could use to screen their patients if there's some kind of suspicion that they might have one of these conditions, so that they can get diagnosed early, they can be managed appropriately. And that's especially true for places that may not have access to geneticists who can order genetic testing or do a genetic evaluation, which is very common that most places don't have genetics. And so here in the US, globally, a tool like this could really be helpful. So yeah, that's the basic idea. And we just got some funding from the John Ritter Foundation to develop that app. And so stay tuned for that as well. Hopefully we'll have at least a prototype soon for that.
Yeah. And that will be for like VEDS and other conditions, or is that VEDS specific?
Yeah. So, well, I should say that it's really the VEDS community that has supported us in kind of getting this off the ground. And we really demonstrated that it works because so many people from the VEDS community provided their images, and we were able to develop this. We published a paper earlier this year about that. But our goal is to have this work for VEDS, for Marfan syndrome, for the different types of Loeys-Dietz syndrome, because Loeys-Dietz is not just one condition. There are many different genes that lead to different types of LDS, and all of them have kind of different facial features or can have different facial features. So our kind of preliminary data shows that it works quite well for LDS as well. But we're hoping that for the non-syndromic conditions, the AI tools might be able to pick up something. But what we found so far that it doesn't work quite as well, but we're still working on that. Most likely it's going to be best suited for these, Marfan, Loeys-Dietz, and VEDS. So that's what our goal is for the app to be used to screen for those conditions, at least at first.
Yeah, that's such a wonderful project. And I love that you highlighted some places not having access to genetic testing or to geneticists, and how this could kind of like bridge that gap a bit.
Yeah. Yeah, I mean, it's not a substitute for genetic testing. It can kind of give you an idea that this might be a potential diagnosis, but then it can kind of get the ball rolling so that they can be referred to a geneticist, or they can, get genetic testing. And, genetic testing is still expensive in many ways. And so in places that don't have any kind of access to that, this might be a tool to help make maybe not make the diagnosis, but raise the suspicion that someone might have this and should be managed appropriately until that definitive diagnosis can be made.
Yeah. I'm curious how, I don't know about Marfan and Loeys-Dietz, but I do know that in VEDS, historically, the research on the facial features and everything has been based mostly on people who are white. How does that impact your facial recognition study? Has the AI been able to recognize these traits in people who are Black or Hispanic? I'm very curious about that to make sure that they don't fall through the cracks too.
Absolutely. I mean, that is a key part of what we're doing, and we're very aware of that. And you're correct. I mean, even today, most of the images that we have are people of European ancestry, although the VEDS community has really come out and helped us trying to get participation from people of different ethnic backgrounds. And so that's been really great. But it is something that we're actively working on. Just went to the Marfan Foundation meeting in Atlanta, and we were able to collect a lot of pictures from people from diverse backgrounds. I will say that our data, the number of non-European individuals in our image data set is lower, but the tool still works for them. But we need more images to really prove that. And because a lot of the features are kind of not necessarily ancestry specific. Like, for example, in Loeys-Dietz syndrome, like type 1 and type 2, sometimes you can get widely spaced eyes, something called hypertelorism. So that's going to be true kind of regardless of what someone's ethnic background is. For VEDS, kind of the large eyes, a little bit deeply set sometimes, and that's going to be true regardless of someone's ethnic background. So what we have found is that, of course, we need more data, but these AI tools still are recognizing those conditions. But we do absolutely need to make sure that they perform as well in every ethnic background as possible, because we don't want to leave anyone behind. And that's a key component of our research and something that we're actively working on. We're also trying to do some things to, how can we leverage kind of existing image data sets that are very diverse and try to kind of incorporate that data into our AI model so that it learns kind of what are the features that you see in people of different ethnic backgrounds. So we're working on it, but you're absolutely right. That's a very important, really, one of the key things that we need to keep in mind for this.
Yeah. If somebody's listening and they want to provide their images for the study, is it too late to do that? Or how would they do that?
No. We have another study in addition to our kind of unsolved cases, something we call MAC, or the Multigenic Aortic Consortium. And so if someone with VEDS, someone with Marfan, someone with Loeys-Dietz, genetically confirmed, because we need to be able to, put them in a certain bucket, but they can reach out to us. Again, you can just Google that and they can enroll in our study. And this facial AI project is a component of that research program, Perfect. The MAC research program.
Perfect. Yeah. I can put that information too. So in the episode description. So if you're listening to this and you're like, heck yeah, I want to be part of that study. The links and things the studies that David has mentioned today will be linked in the episode description, and you can go, I think they're called show notes or something, but it's down there for you. That is so cool. I so appreciate you sharing your current research with us, and the work that you're doing is so important.
Thank you. I love doing what I'm doing. I recently got an NIH grant to continue doing this work. So I'm super excited, and the sky's the limit for a lot of this stuff, and it's through the contributions of the community, the VEDS community, and Marfan, Loeys-Dietz, et cetera, that we're able to push things forward.
Yeah. So I have a bit of a personal question. I actually met you, I believe, through one of my close friends, Bella Marin, who you worked with Diana. How did, like, Bella, if anybody has not listened to Bella's story, for one, she's done a couple podcasts for Staying Connected, and you can go back and listen to her story. But I suspect that most people know who Bella is. What was it like? Like, how did knowing her impact your understanding of VEDS? Had you met a lot of people with VEDS prior to working with her, alongside her, or like really anything that you want to share there? I'm just so interested.
Yeah. Wow. I mean, Bella, it's funny. I tell people this. Bella and I really only worked together for a year, but I feel like I've known Bella my whole life. Just because she has that kind of personality, we clicked immediately, and we're both very passionate about this field. And so, to be perfectly honest, Bella was really the first person that I knew with VEDS. I mean, I certainly knew of the condition, but I had never met anyone with it, despite the fact that before I came to UT, I was at Baylor, the genetics department there, and they have a very strong genetics program in general and clinic, but I had never come across anyone with VEDS. I had with Marfan and several with Loeys-Dietz, but not VEDS. So it was really Bella who introduced me to vascular EDS, and then introduced me to the VEDS community in general. So yeah, I mean, I think everything I know about VEDS is really because of Bella. So now I feel like I know a lot about it. Of course, there's always more to learn, but Bella was really the key to that. And because of that, in my experience with her and the community, VEDS has kind of become one of my main focuses, because it's one of the conditions where I feel we need to do more to really improve lives. And we've been able to do it to a large degree for some of these other conditions, but VEDS is one where I still think we have a lot of opportunity to really do more. Mm-hmm. So yeah, it has become one of my main focuses, and the AI paper that was about VEDS specifically, and that's really all because of Bella.
Cool. Thank you, Bella. No, I really, I appreciate both of you so much, like you and Bella. There's so much I could say, and I just love her so much, and I'm so appreciative for everything that she does. Is there something, speaking to that, like, need to, I think you mentioned it, I think you said there are a lot of opportunities to make changes and lives better. In VEDS specifically. Is there something that if a medical professional or a medical student was listening to this podcast, is there something that you would want them to take away, either from this interview or like information about VEDS, Loeys-Dietz, Marfan, that you would want them to carry into their professional lives?
Yeah, it's an interesting question. I think for VEDS, and this is something that I think you've spoken to a lot on your podcast, the importance of differentiating VEDS from the other types of EDS. EDS is, it's an umbrella term that includes, I think, like 12 different types of EDS. But vascular EDS is really specifically the one that really needs to be separated from those in terms of the complications. If someone comes into clinic, or you're seeing someone and they say that they might have EDS, it's important to then follow up with what type of EDS do you have? Is it the hypermobile form, or is it vascular, or is it one of the others, classical, for example? Because again, they all are under the same umbrella, but vascular EDS really needs to be treated as something very different. And unfortunately, even to this day, a lot of people don't know the difference. And so people with VEDS are not given the kind of priority that they need when they go to the ER or when they go to be evaluated. So that's one thing. I mean, I would say just, be open to reaching out to people like me or to others in this field, if let's say you're a physician or in some part of the country and you have this family or patient with this history that sounds kind of like what we're talking about, do reach out to us to see if we can help add information and see, if what our thoughts are. We're an open book. That's kind of what I could think of off the top of my head. These kinds of vascular conditions, if someone comes in with a dissection, a perforation, or something, always treat them with the highest priority, because these conditions can really cause a lot of complications. But if you can address those things early, you get much better outcomes. Mm-hmm. So I don't know.
Yeah, and you speak to something that Dr. Shireen Shalhoub has mentioned before, mm-hmm. is like knowing that you have the condition can make a big difference, because then you know. So like for every surgery, the surgeon can know that your tissue might behave differently than somebody else's. You know that you need to be monitored more often, and like that you can go in proactively. And I guess I'm just agreeing with you with because it is so important. Like, I'm agreeing with you too. I mean, I think, it's not a bad idea to have some information on you that I have Marfan, I have Loeys-Dietz, I have VEDS, so that you can share that and put some contact information about your medical provider so that, if you go into some random ER, that person can reach out for more information. So that's critical. And I think also for these conditions, it's also, like you were saying, it's really important to keep being followed. I know it can be annoying at times, to go in for your regular annual studies or something, but that's really important in these conditions, because prevention is so much better than having to deal with, the complications if something isn't addressed earlier. So that's what I would say. Yeah, thank you. Is there anything else about your profession or your personal interests that we didn't cover that you would like to?
I don't think so. I mean, we kind of covered everything. I'm committed to this field. I really hope that I'll continue to learn new things and work with the community, different communities, and really help understand these different kinds of conditions and what we can do to improve the lives of everyone that's affected. So that's kind of me. And so.
Wonderful. Something I'd like to ask you before you go today. I really appreciate all of your work. I know I've said that a couple times already, but I just feel like I could never quite express it enough. And I guess I also want to let people know that David is so I don't even know how to say this, so I'm just gonna. Every time that there's a new episode of Staying Connected, it feels like almost every time you reach out or you comment, and it just feels really good to know that you're listening, that a geneticist doing research in this field is listening to personal stories from people who are affected by the condition. And that really means a lot to me. And I don't know if it outs you in any way, but as a listener, it feels really good to know that you're doing that.
Oh yeah. Well, I have to say, I mean, it's one of the, I subscribe to your, YouTube channel, and I always look forward to the new episodes, but it's really through these interviews that I've learned so much about people who are affected with these conditions. And so, I'll meet them at conferences, and then I'm like, oh, I think I know you, but it's because I've listened to the interview with you, Katie. So I think it's an incredible resource, and really enjoy. I feel honored that you would have me on, and thank you for doing what you do. And I think it's a really important part of this field in general. And so I thank you.
Thank you. Do you have any kind of closing message for people with the conditions listening to this episode?
Yes, I would say, keep having hope. A lot of really smart, driven people are working on understanding these conditions and how to improve lives. So I think that will only continue. And I think the future is bright in terms of what we're eventually going to be able to do. I don't know when these things will happen necessarily, but it's through funding. Now we're kind of in a time where things are a little chaotic, but But I think if we keep staying committed and working towards something, that good things will come of that. So keep doing what you're doing, take care of yourselves, and know that there are a lot of people who are working on these conditions and trying to improve lives.
So don't give up.
Yes.
Yeah. Thank you so much, David, for coming on the show and sharing your research and your personal story with us.
Of course. Thank you.
Thanks for listening to this episode featuring Dr. David Murdock, exploring his research and experience with VEDS, Marfan, Loeys-Dietz, and related conditions. If you're ready to meet others, get involved, or need support, there are links for you in the episode's show notes, as well as information on research studies for people with VEDS, Marfan, and Loeys-Dietz, including those with the VUS. If you like this show, be sure to share it on social media or give it a rating or review. You can also support the production of this podcast by joining my Patreon, making a one-time donation, or by buying merch. As always, my top tier patrons are listed in the episode show notes. Thanks for listening, and I'll see you soon.